we are incredibly excited to support you on this journey to greater mobility. Thank you for choosing Pomona Valley Hospital Medical Center as your preferred location to have your joint replacement surgery. Here at PVHMC, we look forward to guiding you through the process from start to finish in the goal of providing pre-surgery optimization, surgical care navigation, and post-discharge follow-up to ensure a safe and speedy recovery. The PVHMC Joint Program is accredited by the Joint Commission for High-Quality Consistent Care and its multidisciplinary approach to healing. This course is a virtual presentation of the information provided in our in-person class and can be used as a reference for you and your family through your surgical journey. Let's begin. The purpose of the joint replacement class and the program is to improve your surgery outcome. With the help of a designated coach and our multidisciplinary care team, we are dedicated to your recovery every step of the way. So who is your coach? Your coach is the person that is helping you after surgery. This could be a family member or a friend who can assist you during your recovery. This person should also view this virtual class to gain an understanding of what your surgical journey will entail. What is total knee replacement? It's really looking at the diseased joint, removing the portion of the bone and replacing it with another material, plastic, metal, or a combination of both, so you can improve your mobility and movement. This is an example of before and after joint replacement x-ray. Preparing for surgery. You can think of this like preparing for a race or a hike. What should you do before, during, and after to prepare for a successful day? Our goal is for you to return home with your coach either the same day as your surgery or the next day. This is where your coach can really help. Your coach can make sure your prescriptions are picked up before surgery, drive you to your appointments, help clear any clutter around the house, and avoid any fall hazards, and most of all, be your biggest cheerleader. Discharge planning begins at your surgeon's office. Depending on what your surgeon feels is appropriate for your surgical case will determine what durable medical equipment is ordered. Examples of durable medical equipment are front-wheeled walkers and commodes for the restroom. These require physician orders to be obtained from your insurance and should be addressed before your surgery. It is a requirement for safe discharge from the hospital because we want to make sure you are safe going home and feel comfortable using the walker. Preparing your home for surgery begins before the day of your surgery. Simply removing clutter, planning for meals, and making arrangements for childcare or pet care can help reduce the chance of falling or even infection on your surgical site. Ask your coach for help, and keep in mind this is temporary but part of your successful recovery. Recovery is different for each person, but plan to be out of work for 6 to 8 weeks. Let's go over a few checkpoints that will move you towards your surgery date. 1. You are already participating in the joint preparation class. 2. You will need to obtain medical clearance from your primary care physician and any specialist you see like your cardiologist. 3. Your surgeons may want a dental clearance from your dentist if there are any concerns for infection. In getting ready for your surgery, your primary care physician, our orthopedic nurse practitioner, and your surgeon may address certain indicators that may impede a healthy recovery. Stop smoking 4 weeks before. Smoking increases your risk for infection and blood clots. Maintaining a healthy weight and diet. Both of these will help with recovery and healing of the surgical site and reduce the chance of infection by improving circulation. Even a few pounds of weight can make a big difference. Improve your diet to include good water intake, fruits, vegetables, and fiber daily. Remember, you're preparing for healing. Good nutrition and hydration is critical to good recovery. If you are diabetic, get your hemoglobin A1C checked and keep it less than 8. Elevated blood sugars can increase the risk for infections and readmissions back to the hospital. Consider these 4 items as goals to optimize surgery, readiness, and recovery. Goals to keep you moving towards a successful joint replacement. Optimization is the goal for your pre-admission visit. Pre-admission testing is done at our outpatient pavilion next to the main hospital. Here, any ordered lab work, x-rays, and EKGs will be done in preparation for your joint replacement surgery. This visit will be done approximately 2 weeks before and will include an appointment with our ortho nurse practitioner. Plan on bringing any clearance and any questions you may have. Our nurse practitioner will review your test results, orders, and conduct any assessments that are required. Details regarding discharge will also be reviewed. This is a great time to go over your preparation for discharge, and if there are any questions about the process. Our focus is to be a partner with you, and we are committed to your success. Part of the commitment includes performing a COVID test 2 to 4 days before surgery. You will be scheduled to return to the outpatient pavilion for a PCR test. This is required for surgery, and results will be given to your surgeon. Here at PVHMC, we want to ensure a safe environment to all our staff, patients, and visitors. Extra care is given to the surgical environment, and PPE is worn by our staff. This commitment is provided throughout every area of your visit. And thank you again for understanding. Before surgery, you will need to discuss what medications you should stop before surgery and for how long. Some of these medications include anti-inflammatory medications, also known as NSAIDs, such as Motrin, naproxen, Advil, or aspirin, will need to be stopped 1 week prior to surgery because these medications can cause additional bleeding. In addition to those medications, a reminder to stop certain herbal medications and vitamins because they can also increase the risk of bleeding. Next is blood clot prevention medication. The physician who prescribed it and/or your surgeon will decide when it is stopped and when it is restarted after surgery. These medications are included but not limited to Plavix, Coumadin, Eliquis, and Xarelto. These medications prevent blood clot formation and increase the risk of bleeding. Another group of medications to consider stopping prior to surgery are medications used for rheumatoid arthritis. Medications like Plaquenil, Humira, and Enbrel should be stopped temporarily and will need to be discussed with your primary physician, specialist, and your surgeon when to resume them. Please review this list and keep your medication list updated to ensure that all medications you are currently taking have been reviewed prior to surgery. Let's get ready for the big day. Pack your bags, even if you are scheduled for same-day surgery. Pack any toiletries and loose garments that you can wear home. You will be provided with shorts and a shirt especially designed for our joint patients, and it can be worn for your first physical therapy session right after surgery. Let your surgeon know if you use a CPAP machine at night for sleep apnea. Bring your machine and supplies, regardless of same day or overnight, so that you get a restful night of sleep. Let's talk about shaving. No shaving below the neckline at least 3 days before. Why is that? You might be asking. Infection prevention is key. Shaving causes breaks in the skin and can be a source of infection. Next is a difficult request for some. Please keep pets off your bed 5 days before and 5 days after surgery. Why is this? Our furry friends carry germs that could accidentally scratch your legs and create a source of infection. Remember, this is temporary, and once your surgical site heals, you can bring your furry friends back. On the night before your surgery, you should receive a call from a surgery department RN who will give you specific directions on the time and location of your scheduled surgery. Surgery may be performed at the main hospital or the outpatient pavilion. The nurse will also review medications you can take on the day of surgery and remind you about the chlorhexidine soap that you will use to shower the night before and the day of surgery. This special soap was provided to you at your pre-admission visit with instructions. Make sure to scrub the area you are having surgery on a little bit more. Rinse well and pat dry. Do not use any soap, lotion, or powders on your skin, and put on some clean pajamas for bed. Repeat this process of showering and apply the chlorhexidine soap as directed the morning of surgery. Remember not to eat any solid food after midnight before your surgery. This will help prevent complications during your surgery and could lengthen your stay in the hospital. Do drink 2 cups of any sort of electrolyte drink like Gatorade, Pedialyte 3 hours before your surgery scheduled time. This is to prevent dehydration and will help you with your post-surgical recovery by reducing any nausea or vomiting. Arrive to the location of your surgery with your coach at the time given by the surgery RN the day before. Please make sure you have a list of your medications, your walker, and insurance information to help facilitate your intake process. Please do not bring any valuables. In the pre-op area, more preparations for surgery will take place. Additional chlorhexidine wipes will be given to you again to wipe down the surgical site, and any clippings of hair will take place in the pre-op area. An IV will be started to administer any antibiotics or other medications ordered by your surgeon. In pre-op, the anesthesiologist will examine you and provide information on the type of anesthesia that will be used. This is your opportunity to ask questions that you may have of your anesthesiologist. Our goal with the joint replacement is to utilize spinal anesthesia to reduce recovery time, but it is ultimately up to the anesthesiologist to decide what is best for you. Off you go to the OR. Surgery usually takes 2 to 3 hours, and the orthopedic surgeon will speak to your coach and family after surgery to update them on your progress. You will be taken to the PACU post-recovery care unit, where specialized nurses will monitor you through your recovery. Your vital signs and surgical site will be frequently examined, and pain assessments will be done to track your progress. After surgery, you will have a dressing on the site where the surgery occurred, and specific instructions will be given on the care of the site. Depending on the type of surgery, you may have foot pumps or sequential devices placed on your limbs to prevent any blood clots from forming, which could lead to a deep vein thrombosis or pulmonary embolism. Both are considered complications of surgery. Ice therapy will also be utilized. You will go home with instructions on how to continue ice therapy and how to utilize the wrap provided. If you are spending the night in the hospital, you will be taken from recovery to a patient room where you will be asked to walk from the gurney to the hospital bed. The goal is to initiate movement as soon as possible. Your nurse will have you get out of bed for meals, and physical therapy will come 2 times a day to help you walk with the walker and measure how far you can walk. If you have stairs at home, stair training can also be provided. Safely moving throughout your house will prevent falls and return visits to the emergency room. Pain management is important for discharge. Managing your pain is vital to your recovery. Using ice frequently and treating your pain appropriately with anti-inflammatory medications, relaxation techniques, and repositioning can help alleviate the breakthrough pain you might be experiencing. Blood clot prevention is key after surgery. The risk of blood clots extends up to 30 days after surgery, and surgical patients are at a much higher risk, but there are ways to prevent clots that you can do. Ankle pumps, moving your feet back and forth in bed, and mild exercise will keep your blood circulating. And take your prescribed blood clot prevention medication like aspirin or Lovenox. Aspirin will usually be prescribed for 14 to 30 days after surgery. Other medications may be prescribed by your physician, depending on your medical history. If you are staying overnight after your surgery, please make sure you call for assistance when getting up out of bed to walk to the bathroom. The nursing staff and physical therapy can help you out of bed. We don't want you to fall or cause any injury to the new joint. Your surgeon will order physical therapy to begin 2 to 3 hours after your surgery. The physical therapist will evaluate your ability to stand and walk with a walker in preparation for your return home. Between physical therapy sessions, you can begin performing ankle pumps and sitting at the side of the bed to prevent blood clot formation and improve your recovery. If the surgeon feels it's appropriate, occupational therapy will also be ordered, and it will begin on the day of surgery as well. After surgery, your leg can feel heavy. This is normal after surgery. Your muscles can be weak after surgery, but movement and exercise can help improve this. Your operated limb may feel longer. This sensation will resolve after a month or so. Tightness. This is due to the swelling that happens after surgery. Use ice frequently as instructed and elevate the operated leg to reduce swelling. The tightness and swelling lasts for several months after surgery. Make it a point to perform ankle pumps to increase circulation. Warm sensation and numbness will improve over time as healing continues. The warm sensation is normal after exercise. Bruising on the operated leg may last up to 8 weeks, especially if you're being prescribed medications to prevent blood clot formation. Any clicking for those with a knee replacement usually resolves over time. Be patient with your recovery, but be motivated to recover. The lifespan of your new joint is impossible to predict. Everyone is unique, and materials used for your joint replacement are improving all the time. There are certain factors that can affect the outcome: your weight, your age, your activity level, and bone strength. Stay healthy and moving to improve your joint success. Recovery is individualized for every patient, but significant functional improvements are seen within the first 3 months, and maximum functional improvements are seen between 6 and 12 months. Begin preparing for your surgery now. Simple exercises that can be done at home 3 or 4 times a day can optimize your recovery. Ankle pumps are a simple exercise that can be done before surgery and after to keep circulation moving and reduce the risk of blood clot formation. Glute squeezes and quad sets can be done while lying in bed. Simply squeezing your buttocks, where your gluteal muscles are located, can improve your ability to stand and lift yourself up. Quad sets utilize the large quadricep muscles located in the front of your leg. Both quad and glute squeezes can be done as much as you can with the goal of 3 sets of 10. Bicep and tricep curls strengthen your arms to allow a smooth transition from sitting to standing and help you to maintain your balance while using your walker. After surgery, there are a few precautions we would like you to adhere to. Avoid placing a pillow underneath the operated leg. It may feel good, but it is crucial that the leg remains straight to allow good extension in the future when you are participating in physical therapy. Keeping it straight can reduce scar tissue buildup and reduce the need for future surgical revisions on the joint. Adhere to weight bearing on the operated leg as directed by the surgeon, and do not stand, bend, and twist at the same time during your recovery. Please avoid using ladders, step stools, or kneeling, as these movements can jeopardize your joint recovery. After your knee surgery, there are 3 exercises that can be performed to strengthen your muscles and joints. Active assisted knee range of motion. Sit down on a chair, take the leg that was not operated on, and cross it over the leg that was operated on. Go ahead and apply pressure from the leg that was not operated on onto the leg that was operated on, stretching the muscle. Passive leg extension. Go ahead and take a seat. Take your operated leg, put it on top of a bed, a chair, an ottoman, and go ahead and press on the leg muscle and apply pressure onto the leg as much as tolerated. Seated leg extension stretch. Go ahead and take a seat, stretch out the operated leg, and press firmly on the leg muscle. Go ahead and stretch this out as much as tolerated. You will be able to increase the length of time as you recover. A few limitations after surgery while you recover. Remember, no strenuous exercises. Start slow and increase as you improve. Sports activities like running, skiing, or contact sports can be too excessive initially after surgery. Ask your surgeon when you can return to those types of activities. Let's review the basics to safely take care of yourself after surgery. Blood clot prevention. Take medications as prescribed by your surgeon and remember to move your legs to improve circulation. Remember to resume your home medications as prescribed by your primary physician and surgeon when appropriate. At discharge, your nurse will review this with you. Medications prescribed at discharge should be picked up before you go home. This is where your coach can really help. Remember to take medication as prescribed to improve your recovery. This information is important to remember and review. Signs and symptoms that require immediate attention are any incision changes like drainage or openings that you are noticing at the surgical site, any fever you are experiencing over 101 degrees Fahrenheit, with chills, shaking, or sweating, any new onset of severe pain with weight bearing on the operated leg, swelling in the operated leg that does not improve with ice or elevation. If you should experience any shortness of breath, chest pain, coughing up blood, or unexplained anxiety, please call 911 and be transported to the emergency department. Let the paramedic and staff know you had a recent joint replacement surgery and what medications you are currently taking. Taking care of your surgical site begins with good hand washing. If your surgeon uses staples, leave the site covered. You may shower, but keep the dressing clean, dry, and intact. Do your best not to wet the dressing. If ordered by your surgeon, a home health nurse or physical therapist will change it at the 7th day marker. You will see the surgeon 14 days after surgery for staple removal and follow-up. If your surgeon used glue to close the surgical incision, you may remove the dressing when instructed by the surgeon and shower as instructed. It is important to pat dry the incision site after showering and do not scrub or pick at the incision or glue. Avoid taking baths or sitting in hot tubs, and no lotions or creams on the incision site until it is fully healed. In the knee joint replacements, no bending or twisting of the knee is appropriate, and keep your legs straight in bed with no pillows under the knee. This will optimize your joint recovery. Change positions frequently in bed to avoid blood clot formations. Get out of bed or from a chair slowly to avoid falling or tripping. Make sure you drink plenty of water and eat a variety of foods to avoid constipation while taking opioid pain medications. Your commitment to healing and recovery is a lifelong process. Exercise and stretching before surgery and after will optimize your movement and mobility afterwards. You and your coach can make sure you begin exercising at home and have the necessary equipment to aid in your recovery. 2 weeks after surgery, you should follow up with your surgeon to check on your surgical incision and see how you are progressing. A good suggestion is to have this appointment made prior to your surgery so that there is no delay in follow-up. Your primary care physician or specialist will also like to see you 2 weeks post-surgery to resume certain medications or to ensure you are recovering well. There is a joint replacement guidebook link on the Pomona Valley Hospital Medical Center Orthopedic Services page that can be downloaded or printed for you or your coach to review before surgery that will cover key points discussed in this presentation. Here are a few important phone numbers that you can call if you have any questions before or after surgery. Feel free to reach out to the clinical coordinator or nurse practitioner for the joint program with any questions before or after surgery. Here at PVHMC, we do offer group classes for our knee replacement surgeries, and it can be a fun way to connect with other patients who are recovering just like you. Stay active. It creates balance, strength, flexibility, and endurance to reduce falls. Keep exercising. It helps build bone mass and contributes to the development of a strong bond between bone and the implant. And slowly increase your activities. Thank you for taking the joint replacement preparation course provided by PVHMC Orthopedic Services. We will be here throughout your journey in regaining movement and mobility.